government's saying it wants to expand the use of private sector providers to unlock spare capacity, get more people the treatment and operations that they so obviously need. It's nothing new. As I said before, the Labour government, well, they began using private sector providers in the NHS 20 years ago, but this is a big expansion they're talking about. Dr. John Puntis is co-chair of Keep Our NHS Public. I've got a feeling where you might be coming from on this one, John. Good morning to you. And Dr. Ian Gargan is with us as well. Ian's CEO of Private Healthcare Information Network. OK, the other side, John and Ian. Lay out your reaction to this one, first of all, John, from a Keep Our NHS Public perspective.
Well, I think it's a poor suggestion, because what we need is long-term investment in the NHS, and that's the only way I think that we will have services that are able to deal with patients' needs. There's all sorts of difficulties with the private sector. I mean, it's quite small and it's very reliant on the NHS and entirely reliant on NHS trained staff. And this idea that there's somehow spare capacity, I think is wrong. If you look at the COVID pandemic, for example, something like 6,500 patients transferred every year from private facilities to NHS facilities. That doesn't speak of them having a lot of capacity. And this transfer of patients from private to NHS is something which goes on all the time. It costs the NHS about 80 million a year. And during COVID, when the private sector had contracts to do more work for the NHS, it actually managed to do 49% less work than it had been doing pre-COVID. So what we need is long-term investment in the NHS. Investing in the private sector. The private sector are not cost minimizers. They are profit maximizers. They're businesses. And it means that money simply flows out away from the NHS into private companies.
Right, let's bring in Dr. Ian Gargan to respond to some of that. CEO of Private Healthcare Information Network. There's not much spare capacity, actually, says John, Ian, and it's all about profit rather than patient care. Of course it is. It's private companies.
Good morning, Chris.
Good morning.
And lovely to hear from John. I would disagree. I think there is capacity. So fin.org.uk collects data for the government. It's a not-for-profit company, looks at all the data, all the episodes of patient care. We talk to all the stakeholders, are the hospitals and the doctors, and we hear that there is capacity, there's efficiencies. It's not all about profit, it's about care. It's a twin-track system. We work with the NHS, and I'm not a representative of the private sector per se. We represent the data that represents the private sector. But from the data, I can see that there is capacity, that it is an environment that is all about quality care and working with our colleagues in the NHS to be able to provide the best care possible and to get down that waiting list that you've just talked about, Chris, which is seems insurmountable. So we need to come up with new solutions.
Just on the point, I mean, we've seen what's happened with dentists, haven't we? And they're got a gradual sort of slip there towards us paying more and more, and the kind of option of paying for private, and actually quite a lot of the time no choice but to pay private. That came because of the kind of need for profit, I suppose. What measures can we put in place to ensure that private companies do prioritise patient care over profits? Because, I'd love to take your word for it, Ian, but, it's the real world out there.
Of course it is. Let's not forget, Chris, the NHS works on a budget, on a bottom line. It tries to work really hard to those budgets that the government stipulates, and the private sector does the same. They may be for profit, but our data represents, and we're not for profit. This organisation has mandated for the government. We look at the length of stay, the mortalities, the wherewithal and the care of patients in the private sector. So we see it as a priority, and we see that those 650 sites that we collect data from, we see they're representing that priority. So I wouldn't say, and look, as a doctor and having practiced for 25 years, I can confidently say it isn't just all about the profit and the money, and let's not focus on that. It is about the care and trying to solve a problem.
John, it's you're cynical. It's not about the profit, it's not about the money, John. It's all about patient care.
Private companies have an obligation to maximise their profit. and that's what they do. They're very heavily reliant on the NHS. There is only one pool of staff. For example, the main limitation on catching up with elective operations is anaesthetists and surgeons. And if they go and spend time working in the private sector, they are not working in the NHS. So the idea that they are then reducing the waiting list is mistaken. Outsourcing generally is associated with lower quality care, and in England has been associated with increased death rates amongst patients.
So do we bin it all then, John? I mean, is there nothing good to be taken from any of this? Are there no specific services or sectors within the NHS? Because, this is the direction of travel, isn't it? And we should underline the fact that this isn't just a Conservative government thing. Labour are saying that this is the step that they would take. And in fact, they would have wanted the government to have done this sooner.
I think what we do need is investment in the NHS and a return to its founding principles and having comprehensive services. We know not long ago the NHS was rated top of the list of 11 richest countries in the world in terms of equality of access, outcomes, efficiency. This has all changed because of underinvestment and lack of staffing, and it could be reversed, and that's what we need to do. Not to build a two-tier system by siphoning off funds that could go into the public service, siphoning it off to private companies. And the broader question comes back to what is the rational way that we provide a health service, actually. And I think the founding principles of the NHS have stood the test of time, and it needs investment. And diverting funds to private providers, whether they're assessing children for autism, doing anything else, means that there is not the investment in the NHS. And you have to have a much longer term vision of the NHS to fix it, and not mislead the public into thinking that there is this spare capacity, that people are just sitting around in the private sector waiting to help the NHS. This is not the case.